Your new president, Dr. John Jeffrey, is a professor of respirology, critical care, and sleep medicine with the College of Medicine. He graduated from the Mayo Medical School in 1991 and followed with fellowships in internal medicine and critical care from the Mayo Clinic and a fellowship in respirology from the University of Manitoba. He joined the faculty at the University of Saskatchewan in 2002, where he was active in collegial governance. He has been a RA delegate for several years and joined the SMA Board of Directors in 2017. He's also been active with the Canadian Thoracic Society and is currently on the board of the Canadian Society for the History of Medicine. Dr. Jeffrey, by virtue of authority vested in me, it is a privilege to install you as president of the Saskatchewan Medical Association. During your term in office, you're charged with representing your colleagues in the province and leading the association, the profession, and the public towards a healthier future. I'll now ask Bonnie Brassard to transfer the chain of office to Dr. Jeffrey. Dr. Jeffrey, congratulations on becoming president of the Saskatchewan Medical Association, and all the best to you in your presidency. Thank you so much.
I would now like to welcome Dr. John Jeffrey, the 56th president of the Saskatchewan Medical Association, president for 2022-23, to give his inaugural address to the Assembly. Dr. Jeffrey.
Thank you, Kishore. Good afternoon, RA delegates and guests. Thank you to Dr. Smart and Stridham, and thank you, Bonnie Brassard, and all the RA delegates. It is quite an honor, and I accept the privilege of being the president of the SMA, and I do so with a sense of humility, but also with a sense of purpose. Our profession needs a strong medical association. Physicians need to have our advocacy efforts strongly presented throughout the province, and I'm ready to undertake that work on behalf of leading the SMA. Today I want to talk especially about resilience and optimism. The pandemic has been a long and difficult time for our province and our profession. The strain on our healthcare system has been immense, and the cost in lives tragic, with over 1,300 deaths in this province alone during the pandemic period. Yet throughout this period, we've seen incredible acts of kindness and caring for each other. I think about the countless hours many physicians have put in. I think about the risks that doctors have taken to deal with patients, putting in many long clinic hours, doing many long days on call in the hospital and weekends working, caring for patients. All of these nights and weekends were important, and you did it because you needed to do that. We needed to have good health care for our patients here in the province. During this pandemic, physicians have been resilient, and despite the pandemic challenges, overall, I think we're all optimistic for the future. COVID is not over, and I need to stress that. We are still in the midst of a pandemic. However, being optimistic, I believe the peak of the pandemic has passed, and we can continue to work together and endure going forward. The famous Antarctic explorer Ernest Shackleton once said that optimism is true moral courage. We have seen resilience and optimism these past couple years, physicians sharing the workload to care for the ill, the frail, and the elderly. Doctors from various disciplines retraining to help with inpatients and critical care. Physicians advocating for mask use, social distancing, as well as vaccinations. There's been tremendous work done by our public health physicians in educating the people of Saskatchewan and shepherding us through the past couple years. I admire them for their vision and perseverance during this time of adversity. As a profession, we have achieved significant milestones in pivoting to virtual care and other adaptations to improve patient health. I want to commend all of you for your service to the people of Saskatchewan, and I applaud your resilience in the face of adversity. However, Not everything is bright and beautiful. These accomplishments have come at a cost to physician wellness and relationships. As you may know, there are 4 pillars to the SMA strategic plan. One of those pillars is to improve physician wellness, and another is to strengthen relationships. These are touchstones for caring for physicians and for improving healthcare here in the province. Many of our colleagues are feeling stressed due to preventable morbidity and mortality, challenging workloads and work environments, and longer waiting lists. You've heard earlier today about the SMA survey results, and we know that physicians are tired and many of you are feeling burnt out. The feedback we have received is that reform of primary care is necessary. We need to think about how society compensates physicians. We need to work together on this issue, and who is we? When I say we, it's an array of stakeholders, but primarily the Ministry of Health, the SHA, the College of Medicine, and of course the SMA. We all must collaborate together to optimize patient care and make Saskatchewan a great place to practice medicine. As SMA President, I look forward to working with that goal in mind. It is important to remember that you're not alone. If you're feeling stressed or burnt out, we are a community here in Saskatchewan of over 2,500 physicians, and there is help available. Whether it is the myriad of supports from the Physician Health Program, financial assistance through the Medical Benevolence Society, counseling or assistance, the SMA is there for you. And besides the services the SMA provides directly, SMA leaders and indeed all physicians need to be there for each other. It is time to reconnect and rebuild. We need to reconnect and rebuild our relationships with the people and the government of Saskatchewan. We need to reconnect with our loved ones and friends who we have been separated from during this long period of pandemic. And finally, as physicians, we need to reconnect and rebuild our relationships with each other. In the coming months, with careful attention to public health recommendations, the SMA will begin outreach efforts in all 4 corners of our great province. Pandemic and weather allowing, hopefully no more snowstorms, the SMA staff and I plan to visit physicians in every MSA to meet and listen to you. We want to hear about your concerns and your ideas for improving health care. As you know, the SMA is a member-based organization and it is driven by your needs and your concerns. What can be done different to help you and to help healthcare here in the province? In closing, I want us to celebrate the resilience and the achievements of these past couple years and to be optimistic looking towards the future. Finally, I really want to thank my family, my mother and father, who raised me to value education and knowledge, my wife Regina, who has supported me throughout my career and during my leadership journey, and finally my sons Tristan and Matthew, who are my future. And thank you very much.
I think you're going to present an award.
Yes, and next I would like to present an award of merit. So my first official act, my first official act is to acknowledge the efforts and successes of my predecessor, my colleague, my friend, Dr. Eben Strydom, the SMA's 55th president. I've worked with Dr. Strydom on the board of directors for more than 4 years. Eben is a champion of family medicine, and he believes in the special calling of rural doctors. He speaks to these topics with passion and clarity. Over the past year, Dr. Strydom and the SMA Board of Directors has worked hard throughout this roller coaster ride of the pandemic. Dr. Strydom has steered the SMA through some of the most difficult times of this pandemic. He is soft-spoken, and yet he is committed to doing the right thing. He is never wavering in his protecting of the interests of the profession and improving health for our patients. When he saw that SMA had to comment, he would speak eloquently. When he saw that action was required, he moved quickly and confidently. Dr. Strydom, like so many SMA presidents before him, learned the delicate balancing act of what's required of presidents to be president of such a diverse group of professionals. He dealt with challenges calmly and always saw a reasonable path through the many competing interests and agendas, those of the public, those of SMA members, and of course those of the Ministry of Health and SHA. Dr. Strydom met with the Minister of Health regularly, and he always took those opportunities to speak up for physicians. Dr. Strydom led the SMA during the slow retreat of this pandemic. He's always been quick to point out that we are not at the end yet, and we all need to stress that. We're still in a pandemic. He understood things because he's been in the front lines as a rural family physician, and he witnessed the challenges that many physicians are still confronting. Dr. Strydom is a passionate advocate for rural medicine. His knowledge and efforts has served him well as the SMA president. Eben, you've left a positive mark. He has helped to revitalize the MSAs, and we and the SMA will see the benefits of this revitalization for years to come. Similarly, he was president when the SMA began the work on improving and reviewing the governance structure. Thank you, Eben, for all your hard work. This past year has really made an impact. I would like to ask you all join me in saying thank you to Dr. Eben Strydom for serving so successfully as the 55th president of the SMA. On behalf of the SMA, please express our sincere thank you. Congratulations again, Eben. In concluding, I want to add that the work of the work of any SMA president cannot be done without the support of family. We have a tradition here in the SMA whereby we recognize the importance of the president's family. With that in mind, I want to acknowledge Dr. Strydom's partner, Mariante, who was tremendously supportive of him during the past year, and indeed during his many years on the SMA board of directors. Even also pass on to your children our thanks, your son Okhart and Liam, and thank you so much for your service this past year. And with that, I will thank the RA. It's been a wonderful day, and I hope everybody has a pleasant weekend, and I look forward to seeing you all again soon. Back to you, Kishore.
Thank you. And congratulations, Dr. Jeffrey. On behalf of the RA, I wish you all the best during your presidency.